Hey folks, today we have a very good case of herpes zoster involving maxillary and mandibular branch of trigeminal nerve. Herpes zoster is commonly called as shingles, and it is a secondary infection to varicella zoster, which is commonly called as chickenpox. And today's case is not so classical because it has occurred in a young individual, young female patient, and she's also not immunocompromised. So this is not so typical case of herpes zoster. And if you haven't seen a case of herpes zoster, this video is for you. Hi, I am Dr. Neha, your maxillofacial physician and radiologist, and I talk about my special cases in this series of video. And today we have a case of herpes zoster. In this video, you will learn how to diagnose herpes zoster, why it is important to start antiviral drugs within 72 hours of rash occurrence. You will also learn different treatment protocols for zoster and how to deal with post-herpetic neuralgia. So this is my patient who is a 21-year-old female who complained of burning sensation and vesicle formation over her right lower half of the face since one day. And in this slide, you could see the vesicles over her lips, her perioral region, her preauricular region, and none of the vesicles are crossing the midline. And when observed intraorally, there were the pinpoint ulcers over the buccal mucosa and palate. However, the tongue appeared normal. Now remember one thing, that the intraoral lesions usually occur after the appearance of cutaneous rash. Now, patient's medical history was not contributory because there was no underlying chronic illness or any other reason for immune suppression, except for the fact that patient suffered from chickenpox in the childhood. So now, before going to the diagnosis, we should know certain points about herpes zoster. Varicella zoster is responsible for two major clinical infections of human. The first is varicella, which is called as chickenpox, and the second, the later or the latent infection, is the zoster, which is also called as shingles. Now, chickenpox, which is a generalized condition, when it is healed, the virus remains latent in the dorsal root ganglia of spinal nerve, and under immune suppression, there is reactivation of this virus, and the vesicle formation or the rash occurrence occurs along the course of the nerve, and that is why it is called as zoster, because zoster signifies belt or girdle. Now, when talking about the occurrence, zoster usually affects individuals older than 45 years of their age, with the mean occurrence at 60 years. Immunocompromised states like HIV has 15 times higher susceptibility towards zoster. Also, 25% cases of Hodgkin's lymphoma develops herpes zoster. Okay, now this picture is taken on the second day after the OPD, where you could clearly appreciate the presence of rash. Now remember one thing, that rash progresses from the erythematous papule and edema to vesicles in 12 to 24 hours, and then it finally progresses to pustules in 1 to 7 days. This pustule then begins to dry with the crust formation, and this crust falls off in 14 to 21 days, leaving hyperpigmented or hypopigmented scarring. Now, the diagnosis of zoster is usually clinical because of its characteristic appearance. Laboratory tests are usually reserved for more atypical cases. For lab tests, what you could do is take a swab from the base of newly burst vesicle in a viral transport medium, and it can be processed for direct fluorescent antibody testing or DNA testing by PCR. Now, DNA testing by PCR usually take a less time for diagnosis, and it is more sensitive than the direct fluorescent antibody testing. And of course, you could do a viral culture, but it takes a longer duration of 1 to 3 weeks, and it is also less sensitive to PCR. Now, coming to the important part, the management. Now, treatment of herpes zoster have three main objectives. The first is the treatment of acute viral infection. Second is the treatment of acute pain associated with herpes zoster. And third, which is very important, is the prevention of post-herpetic neuralgia. Now, antiviral drugs like famiciclovir, valcyclovir, acyclovir can be used for reduction of viral load. These drugs have shown a reduction in the duration of the rash and also the severity of pain associated with the herpes zoster when taken within 72 hours of the rash occurrence. And even after all the precautions taken, if there is a post-herpetic neuralgia, then it can be managed by amitriptyline 25 mg taken at the bedtime. Certain topical agents can also be used, like capsaicin cream or lidocaine patch over the affected area.
So accordingly, antiviral treatment was given to the patient, and this is the picture taken after 15 days where you can see 90% of reduction in the lesion both extraorally and intraorally.
So that's it, folks. That was all about my case, which was herpes zoster. If you want to see more such interesting cases, do visit my channel. I will meet you in my next video. Till then, you take care of yourself.